Okay, so now you've picked up your whitening kit from us. How does it all work? So in the little bag that we give you, you will find this, which is your whitening kit. And inside here, you'll find a little case with the whitening trays in that we took impressions for a couple of weeks ago. So they're in here. And you'll find 2 of these, which has got sufficient gel in to carry out the whitening treatment. There should be 6 syringes in here. Okay, so the first thing to do is to open this up and get your whitening tray out. I've just got one here too. You'll obviously have 2, top and bottom. I've just got an upper one today just to show you how it works. So if you just put that one on one side here, what you need to do is to get one of the syringes. There are 6 of these. The first thing to do is to put the little mixing tip on, which is a little bit fiddly. So I don't know if you can see this. There's a little plastic tab here. So you just need to take hold of this and turn it anti-clockwise and then pull it off. And then you need to replace it with the mixing tip. And in order to do that, you put that on at a slight angle and then you twist it clockwise, which sort of locks it into place. Just make sure it's locked into place to make sure the gel comes out from the right place. And then take there's a little cap here. You just need to pull that off and put that to one side. So now you're ready to dispense the gel into the tray. And so in order to do that, you just push down gently. You'll be able to see it. I don't know if you can see it here, but as you push it down, you can see it sort of coming through the little tip. It's nearly there now. Okay, that's it. So you just pick up the tray and then all you do is dispense a little bit of the gel into each of the little tooth indentations kind of. So just into here, about the size of, probably about the size of a lentil, I suppose. I don't know how clear that is, but you just keep going all the way around, dispensing the gel into each one as you go. Okay, so this tray is loaded and ready to go now, but one thing you may want to do before doing it properly for the first time is to just use the trays without the gel in. So just pop them in and take them out a couple of times just to get the feel for how they sort of seat down, if you like, and then how you get them out. So this tray is ready to go in now. So all you do is pop it in and then seat it into place. I'll just show you quickly, but I can't speak very well with it in, so here goes. Okay, so you would seat that in, pop the lower one in as well. What you might find the first time you put them in, if you put a little bit too much gel in, you might get a little bit coming out over the top of the tray, just onto your gums. You just need to remove that. So in the little bag we've given you, you'll find some of these cotton wool rolls. So just pop that in and wipe it round and just take any of the excess gel off. You can always wrap a tissue around your finger as well. It's quite efficient, but these do quite a good job. So that's it. So once the trays are in, that's it. You just need to leave them for 6 hours. So probably best to just pop off to bed and sleep with them in. It's quite hard to fit 6 hours into a normal working day. So that's it. Once you wake up in the morning, just take the trays out. You just need to rinse out, there'll probably be a little bit of the gel left in, so just clean it with a soft toothbrush. Run it under a coolish tap, not a hot tap. And yes, just use a soft toothbrush just to take it all out. And then shake them dry and pop them back in the case. Close them up, ready for the next time. For the duration of your whitening treatment, there are certain things that you need to avoid eating and drinking. So eating-wise, it's anything that's sort of very highly coloured, say like curries, chilies, red berries, so anything that you would drop on a white shirt that would leave a nasty stain that would be very difficult to get out, avoid like the plague. Also anything to drink, so red wine, black tea, black coffee, anything that might stain your teeth normally, also avoid. You can go back to these things after the whitening has been completed, so a couple of days after you finish whitening, you're fine to do all that again. And there's a little leaflet in the bag which will tell you all this stuff as well, if you just need to refer back to it. But yes, just to avoid all that while you're doing the whitening. So something you might experience while you're doing the whitening is a little bit of sensitivity, and this can vary from patient to patient. Some people don't get any, some people get it quite badly. I get a little bit in sort of certain teeth. I might get some up here, some down here, and some people get it generalised. There are certain things you can do. If it's quite mild, it's not too bad, but it can be, especially if you're not expecting it, can be a little bit alarming. So one of the things that we do put in the little bag is like a desensitizing paste. So we'll explain that to you when you pick up the kit. And again, there will be a little leaflet in the bag to tell you all about how that works. So in the kit that we give you, there are 6 syringes of the gel, which is supposedly enough for 12 sessions. In the little booklet that comes with the kit, it suggests that you should get 3 sessions per syringe, but actually in reality, it's probably more like 2. But we'd always make sure that you have sufficient gel for 12 sessions. Once you've achieved the level of whitening that you're happy with, don't throw the trays away, it has been known. Just pop them back in the little box and then keep them because you'll want to top up every now and again. How often you do this is depending on each patient really. So I would probably do mine once a year. If you're sort of black coffee and red wine drinker, you might want to do it more regularly than that, but just really whatever suits your personal lifestyle. Extra syringes can be bought from the practice, so you can perhaps buy one if you're in for your routine appointment, or you can always pop in and buy them at reception. They're always there. So, of course, if there's anything that you're unsure about at all, just give the practice a call, speak to myself, Justine, or you can, one of the dentists will always call you back if necessary. But yes, anything at all that you're unsure of, just give us a call and we'd be happy to help.